Hi guys, this is Kanika here. I'm the founder of Fem Peers. As you all know, this October it's the Breast Cancer Awareness Month. A lot of things happen around it. Personally, I feel it's becoming very commercialized. We haven't been answering the real practical questions that we all women have around breast cancer. And today, very funnily, I'm sitting with Dr. Radhika. It's a very funny story. About a few months ago, I really went paranoid because I had severe breast pain. And the first thing that came to me when I got the pain was, oh my God, is it breast cancer? And I feel that me, who's advocating so much for women health issues, I myself don't know what are the symptoms, what to do about it, how can we prevent ourselves from all these things, what are the myths around breast cancer. And so we thought that this is a great platform where we can chat about it, get our questions answered. So today I'm with Dr. Radhika. I'll let her introduce herself. And she's I think one of the top specialists in Singapore when it comes to breast surgery, etc. So hi, Dr. Radhika. Thank you so much for being with us today. I'm going to start with a very simple introduction about yourself. Tell us a bit about yourself and what is your practice like? What are the kind of patients you see every day?
Okay, Kanika, thanks for having me on the program. So I'm a breast surgeon. I'm a trained general surgeon, and over the years, my specialty interests went into breast, mainly because obviously I'm a woman, and I thought I'll do something more for women out there. So my interest lies mainly in breast cancer surgery. That doesn't mean that I only see breast cancer patients. I deal with anybody with any sort of breast problems, including men. Okay. So it can range from ladies who are pregnant or breastfeeding with breastfeeding problems, ladies who have breast pain like yourself, any lumps or any symptoms they have. Sometimes they have discharges and all that. So I see all of them. But of course, my pet peeve interest is in breast cancer patients. And I've been in this field for the last about 20 years.
Wow.
And my interest seems to be growing every day.
Yeah. Great. Thank you so much for that introduction, Dr. Radhika. Now, the very first thing that I wanted to ask you was that what are some of the current trends that you are seeing with breast cancer diagnosis? Is it on a rise? Are people getting more aware about it? What is your take on it?
Okay, generally in the world, the incidence is on the alarmingly rising trend. Mm-hmm. But there are two schools of thought about this. One is that because the awareness has increased over the years. If you compare to like 2 decades ago to now, the awareness has increased tremendously across the world. So once the awareness is up, then we think that that's how we pick it up more. On the other hand, the other school of thought is also that somehow lifestyle has changed over the years, and that has posed women at a higher risk of cancer, and hence the incidence has been rising.
Right. So that brings us to a very interesting question. You're saying that lifestyle changes are there, which is making us more prone to, let's say, breast cancer. So what exactly? How should we define the causes of breast cancer, or what are some of the prime causes when it comes to this thing?
Okay. To be honest, we don't really know the cause of breast cancer, but we do know the risk factors which cause which cause breast cancer. The two types of risk factors. One is inherent. Mm-hmm. The other one is lifestyle changes. So the inherent ones, obviously, we have no control over it. It's things like age. It's well known that the older you get, the risk of cancer, breast cancer, is higher. Lifestyle of modern women, which is putting off marriage and putting off having a child at a later age. Use of oral contraceptives for more than 5 years has been shown to have increased risk of cancer. Excessive smoking and drinking, mm-hmm. alcohol, is a definite cause of not just breast cancer, most cancers, in fact.
Yeah.
The other one, which a lot of people think is the cause, is actually a genetic cause of breast cancer, which means you have the bad gene for breast cancer. But I just want to highlight that actually the genetic cause is actually only affects 20% of the population, or 20% of women with breast cancer have a genetic cause, which translates into 80% of women have no genetic cause.
Right.
So it does not mean that if someone in your family does not have breast cancer, you are not going to get it. That's what it means.
Right.
Now, the other arm of the risk factors is things which you can change, lifestyle changes, which are diet, actually, high-fat diet, which also links to obesity, which also links to a high risk of breast cancer. So obesity, and the other aspect linked to obesity is exercise. Exercise has been shown to reduce the risk of cancer, not just breast cancer, in fact, for a lot of cancers.
Right.
And exercise refers to at least about 3 times a week of exercise. And now a lot of women at home, especially homemakers, would think that, well, I'm exercising every day because I'm doing my housework.
Yeah.
Now that is not considered exercise. I just want to highlight that is not considered. It actually means a workout.
Yeah.
At least a 30-minute workout 3 times a week.
Right. Yeah. So, Dr. Radhika, my next question is about myths around breast cancer. I mean, the classic reason why I met you was because I had breast pain, and the sudden thing that came to my mind was, oh my god, I have breast cancer, I think. Yeah. What are some of the myths that you come across every day, you think are on the rise, that people always think that it's leading to breast cancer?
Yeah. Okay, so like yourself, I think 80% of women who come to a breast clinic, they're coming because they have pain in the breast and they're afraid they've got cancer. So, well, it's comforting to know that, when you have pain in the breast, 90% of the time is not cancer. Okay? And about 99% of the time is due to hormonal changes in the body. So usually it's a premenstrual, it's kind of a premenstrual symptom that's causing the pain. On the flip side though, when there's no pain, a lot of people think that, oh, if there's no pain, but I've got a little lump there, but it's painless, doesn't hurt me, it should be fine. Now that's where it's actually wrong. So breast cancer is usually painless. So even if there's a lump and it's painless, you should see the doctor. Okay? It's very unlike other cancers. Like most people link disease with pain. However, breast cancer is quite different in the sense that, there's no pain, it's painless. We call it the silent killer.
Right.
So that's one. Other interesting myths that I've come across is, people tend to think that if we wear underwired bras, it can cause. There's no evidence for that. A lot of patients also ask me, can I use that deodorant or this deodorant, because they're worried. There's no problem with that, because there's no evidence to show all that. They also think that, oh, I've got small breasts, so maybe I have lesser chance of getting cancer, and those with bigger breasts have a bigger chance. I have to say that size doesn't matter here, as long as there's breast tissue.
Okay.
It's an equal chance of having cancer.
Right. Okay. Makes sense. I always used to get that because I have big breasts, and I always used to feel that, oh my god, it's big, so I'm more prone to breast cancer.
You're fine.
It's happened. I'm not happy to hear that, but yeah, that makes sense. Yeah.
The other thing is that a lot of young ladies tend to think that, oh, I'm young, and cancer is only for older women. That's not true. Okay, it is true. It is a fact that the risk is higher as the age goes higher, but it does not mean it can't affect the younger women. In fact, in Singapore, in the Asian countries, we are seeing a rising trend in 35 to 40s age group.
Wow. Okay.
And my own personal experience, my youngest patient is 25 years old and having breast cancer. And they can also have cancer while they're pregnant or breastfeeding.
Okay.
Yeah, so if during this period, if you feel any abnormal lump, please consult a doctor.
Right. So which brings me to the question, Dr. Radhika, we have been getting a lot of these questions where they say that what is the right age to go for mammography, number one. And number two, how often should I get these checks done? Because a lot of women I know around me, they defer for like 3 years, 4 years, they have not seen a breast specialist at all. So what are your thoughts about these two things?
Okay, so according to Ministry of Health guidelines, the recommended age for mammography is 40 years and above.
Okay.
You can do that yearly or 2 yearly according to what your specialist or your GP advises.
Okay.
Because nowadays we also have a differing view about mammography. It really depends on the density of the breast.
Okay.
Mammogram is not able to pick up about 8 to 10% of cancers. It can be missed, and that's especially missed when the breast is dense.
Okay.
When we say dense, it refers to comparing like an opaque material with a transparent material. So if you're an opaque material, if you put something behind, you can't see it. So that's the analogy for dense breast. So let's say you go and do a mammography when actually you feel a lump, that mammography may turn out to be normal. And that's simply because the breast is dense, but you feel a lump.
Yeah.
So in that situation, actually an ultrasound breast would also help.
Right.
So what I'm trying to say is that breast screening, the age recommended is above 40, but that's only for screening purposes.
Okay.
If anyone feels a lump or has any other symptoms with breast, must see a doctor, because the doctor will probably do both mammogram and ultrasound or any other things which is required.
Right.
Yeah.
Makes sense.
Yeah. So then the younger women will ask me, then when do I do screening? Because I'm not 40 yet, do I have to wait until 40? And I just say that the risk of younger women having cancer is on the rise. Yeah, you can always do an ultrasound. I think recommendation, there's no fixed recommendation. Above 30 years or 35 years, do at least once or 2 years.
Okay.
The other thing that every woman can do at home is self-breast examination.
Okay.
The recommendation is about maybe 4 times a year, which means three monthly once.
Okay.
You can do it in different positions because the lumps are obvious in differing positions.
Right.
For example, you can do it at shower when you're showering.
Okay.
You can lift your hand up and then go around the breast. You start from the nipple, covering the entire circumference of the breast, including the armpits.
Okay.
And then do it also when you're lying down, because some lumps are very deep in the breast. They won't be obvious when you stand up.
Right.
So when you lie down, again do the same motions. And the best timing to do this, if you're premenopausal, is about a week after the menses has stopped.
Okay.
If you do just before the menses, then the breast tends to be swollen with all those hormonal changes.
Yeah.
And you're definitely going to find something. And then you'll panic. So don't do that. Do a week after the menses has stopped.
Right. Okay. Great. Thank you so much. That's very helpful, actually. So, Dr. Radhika, it brings me to the last segment. I want to ask you, what are some of the preventive measures that we can adopt to keep ourselves away from breast cancer?
Okay, you can start with diet. Basically, we advise healthy diet, which means a balanced diet. We're not saying avoid fast food completely. We're just saying have a healthy combination of carbohydrates, protein, fibers, and add a dash of antioxidant food in your meal as well.
Yeah.
That includes like things like broccoli, beetroots, all those colorful vegetables. And I think the young people would also like to know that red wine has a lot of antioxidants.
I love that.
So although I said alcohol is a risk factor for cancer, I'm referring to excessive alcohol intake.
Yeah.
So for women, actually 2 glasses of wine, red wine a week is actually is okay for them. It is good for health as well.
Okay.
The other aspect is regular exercise. Regular exercise referring to at least 3 times a week, at least for 30 minutes per session. It's been shown to keep your body healthy because it brings out what we call the happy hormones. And the happy hormones during exercise actually shoo away the bad cells and the bad chemicals which can trigger cancer cells.
Right.
On the same note is that a lot of people are going through nowadays in the fast-paced life is high stress lifestyle, which you can say in Singapore is a bit unavoidable. But even though they're not, it's quite difficult to have big literature on stress causing cancer, but we all know as doctors that stress just decreases your immune system. And when it does decrease your immune system, that's when a lot of cells start clicking in terms of overgrowth. And overgrowth we refer to cancer.
Right.
So try and adopt a stress-free lifestyle, which is difficult in your work, but maybe you can include things like yoga or regular short breaks or holidays, which can, on the whole, help yourself and your family.
Fantastic. Yeah. And then the last thing I remember you were mentioning about self-examination. That's, I think.
Yeah, that's right. So it's good for every woman to know yourself. You need to know how the breasts are in your normal state, so that if in future any lumps pop up which is abnormal, then you can identify it.
Right.
So it's important to do a self-breast examination at least once in 3 months.
Okay.
And you can do that. You time it about a week after your menses.
Great.
On this aspect, I would also like to highlight that a lot of women, and especially Indian women, shy away from seeing the doctor even if they find a lump. And there are two reasons for that. One is they're shy because this is a very intimate aspect of their body.
Mm-hmm.
Two is because they fear that if it's cancer, then they're going to lose their integrity, they're going to lose their body image, and they think that VSS is going to take away the breast. Now I'm going to tell them that please don't do that, because you are the prime, the center of the family. If you are not there, you don't take care of your family, then nothing else will work. And medicine has improved so much nowadays that we don't remove everybody's breast at all. We have so many techniques to preserve it. And the main thing is, if you catch it early, the chance of preserving it and not removing the breast is a lot higher. If you wait and the tumor gets bigger, then maybe it might be too late.
I love that. I mean, to all our viewers, I would definitely encourage, as Dr. Radhika said, that please don't shy away from it. We have such great female doctors as well. I mean, if you feel that male doctors is not the doctor you would want to go, I would suggest please see female doctors. We have Dr. Radhika as well. We have really great doctors out there. Don't wait for it, because if you wait and have found a symptom, it will just keep getting worsening. And as you said, there are so many advanced medical solutions out there now that, touch wood, we can get things fine and back to their original state as they were, I guess.
Absolutely.
Thank you so much, Dr. Radhika, for joining us.
Thanks.
It was really splendid, and I'm pretty sure all of us out there can really, really benefit from it. Thank you so much.
Thank you very much.